types and methods of birth control, and I will explain these to you. There is your natural family planning, it's right here. It's a contraceptive method that uses the natural functions of your body and your menstrual cycle to calculate ovulation. It is 80% effective in preventing pregnancy. It does not prevent STDs. Then you have your male condom, and that is a tube of thin material that is rolled over the erect penis prior to contact with the vagina, and that is 97% effective in preventing pregnancy, and that does help prevent STDs. Then you have your female condom, and that is a 7-inch long pouch of polyurethane with 2 flexible rings, and is inserted into the vagina prior to intercourse, and that is 80% effective in preventing pregnancy. Then you have spermicides, and they are chemicals that are designed to kill sperm, and they are only 80% effective in preventing pregnancy. Then you have your diaphragm, and that is a soft rubber dome that is stretched over a flexible ring. And then that dome is filled with a spermicide, cream, or jelly, and that is 88% effective in preventing pregnancy when it is used with a spermicide. Then you have your cervical cap, and that is a small cup made of latex rubber or plastic, and that is 60% effective in preventing pregnancy when it is used with a spermicide. Then you have your contraceptive sponge, and that is a soft, saucer-shaped device made from polyurethane foam, and that is about 89 to 91% effective in preventing pregnancy. Then you have the birth control pill, and that is taken daily as prescribed by your healthcare provider, and that is about 92% effective in preventing pregnancy if you take it on a daily basis. Then you have your Depo-Provera, and that is an injection that is given by your healthcare provider that prevents pregnancy for 3 months, and that is about 99.7% effective in preventing pregnancy. Then you have Lenel, which is also another form of injection that is given by your healthcare provider, and that prevents pregnancy for 1 month instead of 3 months like the Depo-Provera. And Lenel is about 99% effective in preventing pregnancy. Then you have the NuvaRing. That is a flexible ring that is inserted into the vagina for 3 weeks. Then you remove it for 1 week, and then you replace it with a new ring. And that is about 92% effective in preventing pregnancy. And the birth control patch, and that is placed directly on your skin with the hormones that are built into the sticky side of the patch. And that's how that works, because you just stick it on your skin there, and the hormones work. And that is about 92% effective in preventing pregnancy. The IUD is a small plastic device, and that contains copper or hormones, and that is inserted into the uterus by a medical professional. And that is about 99.9% effective. And then you have the withdrawal method, and that just involves the removal of the erect penis from the vagina prior to ejaculation. And that is only about 30% effective in preventing pregnancy. Then you have the tubal ligation, and that is a surgical closing of the fallopian tubes, which carry the eggs from the ovaries to the uterus. And that's about 100% effective. Then you have the vasectomy, and that is the surgical closing of the tube that carries sperm, and that is about 100% effective. Then, of course, you have abstinence, and that is having no sex. And that is the only proven 100% effective in preventing pregnancy and STDs. So there are 4 different methods, which are broken down into fertility awareness, your barrier methods, your hormonal methods, and then your withdrawal and sterilization methods. And now that you know there are different types and methods of birth control, you should know which one is right for you. I got information from the American Pregnancy Association, Examiner.com, and Team Health.